Last year's state budget, Pennsylvania lawmakers established a commission on adult mental health to help them distribute one-time American Rescue Plan dollars. Democrats were hoping to include the commission's recommendations in this year's budget, but they say the Republican-controlled Senate had other plans with the funding. Erie News Now state capitol correspondent Brendan Scanlon joining us live with the latest on why Democrats say time is running out. Good evening, Brendan.
Hey there, Mike. Good evening. That's right. Well, if that $100 million in one-time American Rescue Plan funding is not spent by December 2024, then it will need to be sent back to the federal government. Now, while both parties sort of debate over exactly how and where those dollars should be spent, the clock is also ticking for behavioral health professionals who say this crisis is only getting worse.
Estimations suggest that 500,000 Pennsylvanians or more are going every year without any access to mental health services that they need.
According to doctors and advocates, Pennsylvania's shortage of behavioral health professionals is profound.
Myself and those in search of behavioral health services and their families are exhausted.
The shortage is leaving those who rely on services in a very difficult position.
But I was told that there were no other providers, no appointments. Just, sorry, we can't help you. Without providers, how do you get well? Where do you start? What do you do?
Last year, the House and Senate approved the formation of the Behavioral Health Commission on Adult Mental Health to allocate $100 million Rescue Plan dollars. The Commission's recommendations, adopted into House Bill 849, included $34 million for workforce recruitment, over $31 million for criminal justice and public safety, and more than $34 million for the stability and expansion of services. The House passed the investments with strong bipartisan support in June, and Democrats were hoping to see them in this year's budget.
In this year's budget, the Senate went back on their word. The Senate zeroed out adult-based mental health and instead funded school-based mental health. This is not an either-or proposition. We need to fund both.
Representative Mike Schlossberg is the sponsor of House Bill 849. Whether included in this year's budget or passed separately, he says lawmakers need to provide the relief for those struggling.
We believe that mental health and caring for the mentally ill is one of the most important and timely things that government can do today.
And Mike, we did reach out to Senate Republicans who told us that there are important increases for adult mental health services in this year's yet to be finalized state budget. You could find more on what they had to say up on our website, erienewsnow.com. But for now, reporting live at the state capitol, I'm Brendan Scanlon. Mike, back to you.